Welcome to the online education portal of environmental and occupational health. Today we will go for the environmental toxicology, and under environmental toxicology we will go for microbial agents, symptoms, effects on environment and management. How it affects, what are the agents and what are the systems. These microbial toxins, they are produced by the microorganisms which are mainly involved bacteria and fungi, and these toxins, they promote the infection and the diseases by directly damaging host tissues and by disabling the immune systems. Some of the bacterial toxins such as botulinum neurotoxins are the most potent natural toxins which are known to be, and the microbial toxin terminology is mainly reserved by the microbiologist for toxic substances produced by the microorganisms that are of high molecular weight and have antigenic properties. They are toxic compounds also which are produced by bacteria and do not fit these criteria are referred to simply as the poisonous. These include some of the most toxic substances such as tetanus toxin, botulinus toxin and the diphtheria toxin. Bacterial toxins may be very toxic to mammals and may affect a variety of organ systems including the nervous system and the cardiovascular system. What are bacterial toxins? Bacterial toxins are the substances which are produced by bacteria that are capable of causing harm to host, and many gram-negative bacteria have lipopolysaccharides toxins associated with their cell walls, and these bacterial proteins, they are toxins usually secreted and are produced by a variety of bacteria. These bacterial toxins, they are produced by proteins and encoded by genes, and the DNA sequences can be analyzed. Bacteria generates toxins which can be classified as exotoxins and endotoxins. Exotoxins are those toxins which are generated and actively secreted. Endotoxins remain inside the part of the bacteria. Usually, the endotoxin is a part of the bacterial outer membrane and is not released until the bacterium is killed by the immune system. So, the difference between the exotoxins and endotoxins are that the exotoxins are produced inside mostly gram-positive bacteria as part of their growth and metabolism, and they are then secreted or released following lysis into the surrounding medium. Whereas endotoxins, they are the part of the outer portion of the cell wall of gram-negative bacteria, and they are liberated when the bacteria die and the cell wall breaks apart. So, we will go for individually what are the features of the endotoxins. The main characteristics of the endotoxins, that these endotoxins, they are formed only by the gram-negative bacteria. They are the lipopolysaccharides. Lipidae is responsible for toxicity. They do not have any specific receptors. They are moderately toxic and fatal to animals in the large doses. Their synthesis directed by the chromosomal genes. The endotoxins, they are relatively heat stable and they usually produce during the fever in host by release of the interleukin-1 and other mediators. All endotoxins can produce the same sign and symptoms: chills, fever, weakness genital, aches, blood clotting, and can also induce the miscarriages. The organisms which are responsible for the production of endotoxins, they are mainly Salmonella typhi, Proteus species, Pseudomonas species, Neisseria species, and the complications which can be created by the endotoxins, or the diseases which comes after the effects of these endotoxins, they mainly involve the liver, leukopenia, hypoglycemia, hypertension and shock. These are the few diseases which happen to take place due to complications of the endotoxins. Now, the bacterial agents, they are defined by mainly its virulence or ability to induce diseases, mode of transmission, incubation period and the mortality rates. These are the few on the basis of which these bacterial agents, they are defined. In spore form, the bacterium can survive in extreme temperatures, radiation and lack of nutrients, air and water for extended periods of time, and they are revived again when nutrients are abundant in nature. The clinical manifestation of bacterial infection that has been seen in all of the human organs which are susceptible to bacterial infections. Each species of the bacteria has predilection to infect certain organs and not others. For example, Neisseria meningitis normally infects the meninges or the covering of the central nervous systems, causing meningitis, and can also infect the lungs and thereby leads to the pneumonia. The systematic inflammatory response syndrome usually caused a bacterial infection, which is an overwhelming inflammatory response to infection manifested by release of large numbers of the cytokines and presenting with sign of infection and early signs of hemodynamic instability. There is a reservoir for the bacteria. What kind of the reservoir? It may include air, water, soil, food, human and the animals, and the diseases which can be caused by these different reservoirs of the bacteria are as such. For example, we take a reservoir of air, it will cause the tuberculosis, water will causes the Shigella and the Legionella, the soil will cause the botulism, tetanus, etc. Food will cause the Vibrio, etc. Human will cause the typhoid, fever, syphilis. Animals reservoir will cause the anthrax, salmonella, etc. The mode of transmission of these bacteria, there are many. They can be transmitted by number of modes. Number one is the contact, airborne, droplet, vectors and vehicular. For example, contaminated inanimate objects such as food, water and the fomites. So, these are the modes of transmission by which they can infect and transmit to another. Now, the modes of transmission of bacterial infection and their diseases, what they can cause. The first is the vehicular, and in this vehicular mode of transmission, the disease which can be caused by means of the food, and in droplet the disease which was caused by is the influenza, meningitis. In airborne, tuberculosis is the another disease which can be caused. Contact mode of transmission, we have syphilis, salmonella, streptococcus. These are the different diseases which can be caused by the means of the mode of transmission of the contact. Vector is another mode of transmission by which Lyme disease or Shigella, epidemic typhus, these are the another kind of the disease which can happen to take place. Now, we will go for the overall view of the bacterial infection in the human body. First, we start from the head, where the bacterial meningitis is the main infection happen to take place by the organisms. Streptococcus pneumoniae, Neisseria meningitis, Haemophilus influenza, Streptococcus aedes, Listeria monocytogenes. So, these are the few diseases which happen to take place due to the bacterial infection at the head. Now comes to the otitis media. Here the Streptococcus pneumonia is responsible. In case of the lungs pneumonia, this can be by means of the community, and Streptococcus pneumonia, Haemophilus influenza, Staphylococcus aureus, Mycoplasma pneumonia, Chlamydo pneumonia, Legionella pneumonia, tuberculosis, Mycobacterium tuberculosis. These are the few another diseases which happen to take place by means of the bacterial infection. Now comes to skin infection. In skin infections, Staphylococcus aureus, Staphylococcus pyogenes, Pseudomonas aeruginosa, these are the three bacteria which are responsible for skin infection. Eye infection, three bacteria, Staphylococcus aureus, Nisa gonothoria, Chlamydia tracheomatis, these are the another bacteria which are responsible for eye infection. Another sinusitis concern, it has two organisms or bacteria which are responsible for sinusitis, that are Streptococcus pneumonia, Haemophilus influenza. Respiratory tract is infected by two bacteria, dominating bacteria, Streptococcus pyogenes and Haemophilus influenza. Gastritis is contaminated by Heliobacter pylori bacteria. Food poisoning is caused by Campylobacter, Salmonella, Shigella, Clostridia, Staphylococcus aureus, E. coli. These are the food poisoning bacteria. Urinary tract infection is being taken up by the E. coli, Enterobacteriaceae, Staphylococcus and Pseudomonas aeruginosa. These are responsible for urinary tract infection. Now comes to the sexually transmitted diseases. These are taken up by the following bacteria. Number 1 is the Chlamydia, Trachomatis, Neisseria, Treponema, Uroplasma and Haemophilus. These are the few bacteria which are responsible for sexually transmitted diseases. Now first we will go for Salmonella infection. This is a genus of the rod-shaped gram-negative bacteria. Two species of Salmonella, mainly Salmonella enterica and Salmonella bongeri. These are the two species which are responsible for this Salmonella. They are intracellular pathogens, and the Salmonella species, they are non-spore forming, predominantly motile Enterobacter with cell diameters between about 0.7 and 1.5 micrometer. Salmonella species can be invasive and cause paratyphoid fever, which requires immediate treatment with antibiotics. So this is a Salmonella is a bacteria that can produce a diarrheal illness. Typically it is mainly contaminated by the food, and it is mainly caused by the contact, and it also it is a very infected bacteria actually. It is a common bacterial disease that affects the intestinal tract, and it live in animal and human intestine and are shed through fecus. Human become infected most frequently through contaminated water or food. Typically, people with Salmonella infection have no symptoms. Others, they develop diarrhea, fever, cramps within a span of 8 to 72 hours. Most healthy people, they recover within a few days without specific treatment of any kind of the medicine. Now, what are the causes of this Salmonella bacteria? Mainly the cause of, or the you can say sources, they are the raw fruits or vegetables, raw and undercooked meat, which mainly involves the chicken, turkey, duck, beef, pork. These are the few sources. Unpasteurized milk and dairy products, raw or undercooked eggs, processed food like chicken, nuggets and nut butters, poor hand washing. Animals like dogs, cats, birds and reptiles, they can carry the Salmonella bacteria. So these are the main sources or the causes of the Salmonella. So what are the symptoms and prevention of this Salmonella? The symptoms and prevention of this Salmonella, they are the mainly symptoms: fever, abdominal cramps and diarrhea. It starts to 72 hours after infection and usually lasts 4 to 7 days. It can also spread from animals to people. Always wash their hands after contact with the animals. These Salmonella, they are very much common. This bacteria is very much common in warmer weather and unrefrigerated food. These can be found in vegetables, eggs, chicken, pork, fruits and even processed food, and can be more dangerous to younger children and the older adults as well as the sick people. So cooking to avoid the Salmonella, we must have a proper cooking at a proper temperature and do not cross contaminate. Cleaning is very important factor to avoid the Salmonella, and to refrigerate the food in a proper manner. What can be the remedy of the Salmonella? The remedy of the Salmonella is to take the mild food, hydrating beverages, antidiarrheals must be taken, healthy pads, heating pads must be taken, painkillers, probiotics. These are the remedies for the Salmonella which we must take after this infection. Next bacteria is the botulism, which was infected by the Clostridium botulinum. Clostridium botulinum is a bacteria that produces dangerous toxins under low oxygen conditions, and these are one of the most lethal substances known to be. Botulinum toxins block nerve functions and can lead to respiratory and muscular paralysis. Foodborne botulism caused by the consumption of improperly processed food is very much rare but potentially fatal diseases if not diagnosed rapidly and treated with the antitoxins. Now, what can be the causes of this botulism? The causes of botulinum toxin is a poison produced by the bacterium Clostridium botulinum, is common in soil and exists in untreated water. It can survive in these environment as a resistant spore. Clostridium botulinum produces spores that can survive in poorly preserved or canned foods. Here they produce a toxin, and when consumed this canned food, even in the minimal amount of the toxin, that can cause a severe poisoning. Now, there are two types of the botulism. One is foodborne botulism and another is the wound botulism. What is the difference between this foodborne botulism and the wound botulism? The foodborne botulism is caused by consuming foods containing the botulinum toxin, and the wound botulism can occur if the organisms enter an open wound and produces toxins within the wound. Injections. Drug users are at risk for this type of the botulism. Now, another infant botulism and adult intestinal colonization is another difference. It happens when an infant consumes the bacteria or their spores and these grow in the gut. Infant botulism in the US mostly comes from eating honey or the corn syrup. The bacterium may also occur naturally in the stool of an infant, whereas the adult intestinal colonization of this bacteria is rare form of the botulism that occurs when the bacterium colonizes the digestive tract of an adult. Now, what are the food sources which are associated with the botulism? The main sources, there are 5 in nature. One is the home canned vegetables, number 2 is the cured pork and the ham, number 3 is the raw or smoked fish, number 4 is honey, and number 5 is the corn syrup, which is mainly associated with the botulism. Now, what can be the symptoms of this botulism? The symptoms of the botulism mainly involves the dropping eyelids, facial weakness, difficulty in swelling, dry mouth, trouble breathing, nausea, vomiting and paralysis. These are the main symptoms of this botulism, and it also causes the hypotonia. Hypotonia is the main cause of in which the muscles they get toning of the muscles get decreased by this. The next symptom is the progression, and it involves mainly the starts or paralysis of the facial muscles, and it also related the symptoms with the blurred vision, difficulty in speaking, trouble swelling and in the dry mouth. The second paralysis may spread to neck, arms, chest and the legs. How the diagnosis can be done? The diagnosis of this bacteria can be done by the brain scan, cerebrospinal fluid examination, electromyography, endophonium chloride test for Mycethenia gravis, and if the toxin is identified in the food, stomach, vomit, fecus or intestinal content, a definitive diagnosis can be made. How it can be prevented, the botulism? It can be prevented by refrigerating the foods within 2 hours after cooking. Proper refrigeration prevents the bacteria from producing these spores. The food must be cooked very thoroughly and avoid the food containers that appear damaged or the bulging. The next bacteria is the Clostridium perfringens bacteria. These are one of the most common causes of the foodborne illness or food poisoning. This CDC estimates that these bacteria causes nearly on an approximate 1 million illness in the United States every year. This Clostridium perfringens can be found on raw meat and poultry, in the intestine of animals and in the environments. The symptoms which has been associated with Clostridium perfringens infections are: number 1, they develop diarrhea and stomach cramps within a span of 6 to 24 hours after eating the contaminated food. The second symptom which has been developed by this Clostridium perfringens is the illness usually begins suddenly and lasts for less than 24 hours. Diarrhea can cause dehydration, so it is important to drink plenty of the fluids. This infection usually does not cause fever or vomiting. It cannot be passed from one person to another. Now, what can be the diagnosis for this particular Clostridium bacteria or the treatment? Most people, they recover from this Clostridium perfringens infection without antibiotic treatment, and the patient should drink extra fluid as long as the diarrhea lasts. Second very important diagnosis is to refrigerate the leftovers at 40 degrees Fahrenheit or colder within 2 years after cooking the food. Number 3 is the reheat leftovers at least 165 Fahrenheit before serving. So these are the few treatments which can be done. These Clostridium, another species of this Clostridium, these are known as gas gangrene, and it is life-threatening muscle infection that develops either contagiously from an area of trauma or hematogenously from the gastrointestinal tract with muscle seeding. In this Clostridium species, there is an early recognition and aggressive treatment is required, very essential, and this Clostridium myonecrosis is broken down into two main forms, that is traumatic and spontaneous. So Clostridium mycococcus bacteria symptoms are very different from the Clostridium before species, that is fever, fatigue and dehydration. These are the three signs and symptoms of this Clostridium species. Extreme pain happen to take place, swelling due to fluid accumulation, edema that can be known as sepsis is another symptom. It is widespread blood infection in which the infection spreads to other areas of the body. So these are the four signs and symptoms of this Clostridium species. Now, what can be the treatment of this Clostridium myonecrosis? The treatment, there are three types of treatment of this bacteria. Number one is it requires supportive care, that means manage the fluids and the hemodynamic status. High dose of antibiotic treatment is required in this bacteria, and it requires the prompt and complete surgical exclusion of the necrotic tissue. Next is the aspergillosis. This is another bacteria infection which is caused by the Aspergillus species, and it is a common mold, and it lives in the indoors and the outdoors. Most people breathe in Aspergillus spores every day without getting sick. However, the people with the weakened immune system in lung diseases are at higher risk of developing health problems due to Aspergillus. This type of health problems caused by Aspergillus includes the allergies, your lung infection and infection in other organs of the body. So how the Aspergillus fumigatus that get infected, that give the fungal growth to the lungs in the human body. So the spores of the Aspergillus fumigatus, they are very harmful for the lungs. Now the symptoms which can be happen by means of this aspergillosis, the symptoms of mainly includes the allergic bronchopulmonary aspergillus, which are very much similar to asthma symptoms, and in this it includes the wheezing, shortness of the breath, cough and the fever. Whereas the symptoms of allergic aspergillus synodie, another species, it includes the stiffness, running nose, headache and the ability reduce the ability of the smell. The symptom of aspergilloma, it mainly includes the cough, coughing up blood, shortness of breath, and the chronic pulmonary aspergillosis includes the weight in loss, cough, coughing up blood, fatigue, shortness of the breath. So these are the different symptoms of different sick and symptoms of aspergillus: pain in chest, pneumonia, blood in sputum, blood in urine, headache. These are the few symptoms and sign of this aspergillosis. Fungus in the lungs, colonizes and lung scare. These are the few symptoms of this aspergillosis. And what are the treatment? Treatment are the surgical. Invasive disease is difficult to treat, and there are medicines for that, and it decreases the immunosuppression or reconstitute immune defenses. Another bacteria is pneumocystis pneumonia. It is a serious infection. It causes inflammation, fluid buildup in your lungs. It brought to you by a fungus known as Pneumomycetes jirovecii. It spreads through the air. It can cause the lung infection in the immunocompromised patients. It is commonly seen in the people who have a weakened immune system, HIV/AIDS. The risk factors of the pneumocystis pneumonia are mainly the person with the malnutrition, and it happens only in the person who had the organ transplant and who have HIV, who have blood cancers, who have take certain drugs for autoimmune diseases such as rheumatoid arthritis, inflammatory bowel diseases, and multiple sclerosis. Opportunistic infections such as pneumocystis or malignancies such as Kaposi sarcoma can signal the final stage of HIV infection and AIDS. The symptoms of this pneumocystis pneumonia, they may be fever, dry cough, shortness of breath, fatigue, chest pain, chills, and the weight loss. Now we will see the symptoms, diagnosis and treatment of the pneumocystis pneumonia. Fever, non-productive cough, chest lightness, progressive dyspnea, night sweats. These are the symptoms of this bacteria, and the diagnoses are the chest x-ray, gallium scans, immunofluorescent, histochemical staining, and PCR. These are the few diagnoses. When we talk of treatment of this bacteria, it includes the pentamidine, TMP, clindamycin, TMP, diapason, trimethotrexate, atoquinone. These are the few treatments which can be done for this treatment of the bacteria, that is pneumocystis pneumonia. Now next comes to the virus. Viral agents, they are also responsible for the diseases. What is now virus? Virus is a microscopic infection agent. It is made up of RNA or DNA as their genetic material, and study of viruses is known as virology. The entire infection of virus particle is known as viren. Virus infect host cell, no reproduce, prolific and found in almost all forms of life. Viruses are much more difficult to treat than the bacteria. Now we will see how the virus works. The virus that enters the cell wall, it releases the RNA, and after releasing the RNA, it invades the cell nucleus and takes over. This viral RNA uses the host cell to create new RNA and assemble more viral particles. New viral particles are released, sometimes destroying the cell during the processes. So it is very much like the replication: first attachment, then entry, then replication, assembly, and release. These are the main 5 processes by which the virus works. First it gets attached to the cell, then enters, then replicate, then assembled, and then again releases. So we will study the rotavirus. It is a very contagious virus that causes diarrhea. Before the development of a vaccine, most children had been infected with the virus at least once by age 5. This virus, rotavirus, is a contagious and most common cause of diarrhea in infants and young children worldwide. Inflammation in the stomach and intestine happen to take place by the rotavirus, and it can cause severe diarrhea, vomiting, fever, belly pain, and dehydration in the infants, young children, and some of the adults. This sunken abdomen is the main, you can say, symptom of this virus. Sunken eyes and cheeks, decreased skin turgor, dry mouth or the tongue, few or no tears, and sunken fontanelle. These are the few symptoms of this virus. Rotavirus vaccines, there are 2 vaccines for this virus. One is known as Rotatag, another is Rotavax. Both are oral vaccines, and they usually given at the same time at the childhood vaccine, and if decided upon by the parents. The treatment for this rotavirus is to drink plenty of water, soups, broth, take Pedialyte or other fluids like electrolytes, eat a diet of bland food such as white toast and the saltiness, avoid sugary or fatty foods as they can make diarrhea worse. Viral agents, they are the biological weapons, and they are also known for the agents of bioterrorism. Multiple viral agents have been classified by the CDC as the potential weapons of mass destruction or agents for biological terrorism. Agents such as smallpox, viral hemorrhagic fever, viruses, agents of viral encephalitis and others are of concern because they are highly infectious and relatively easy to produce. Although dispersion might be difficult, the risk is magnified by the fact that large populations are susceptible to these agents and only limited treatment and vaccination strategies exist. Another very important is the COVID-19 coronavirus diseases, which is we all faced in 2019, and this is a respiratory illness, COVID-19. It is caused by the virus known as coronavirus. This coronavirus was first discovered in China, and on January 31st, 2020, Health and Human Services Secretary, they have declared a public health emergency for the United States. The symptoms of coronavirus, it may be running nose, coughing, fever. These are the few symptoms of the COVID-19, and not everyone will feel the sick. It is the sometimes it remain hidden, and 1 out of 5 reported as having no symptoms. COVID-19 spreads primarily from person to person, and then due to the close contact with someone risk like hugging and shaking. These are the few things by which the spread of COVID-19 takes place, and droplet released is another parameter for the spread of the COVID-19. How can we reduce the risk of the COVID-19? As we all know, clean your hands, cough or sneeze in your bent elbow, avoid touching your eyes, nose and mouth, avoid close contact with someone, clean and disinfect frequently touched objects and the surfactants. And what can be the tips for the prevention for the coronavirus? Mask is the temporary, hand wash, always keep the mask on your face and clean your hands. Disinfectant must be with you, so that as and when you touch any object, you can clean your hands with the disinfectant. So the COVID-19, the number of cases in India, they are on an approximate 43,000 per day in the early stages. In 2020, COVID-19 was the third leading cause of death in the US. Besides this, the maximum people in US or the developed country, they are by means of the heart diseases, cancer, but now it has been by means of the COVID-19. Thank you.